Okay, we now have Dr. Brannigan on. This is the Vision Care Show. This is John Monroe, host of the show. And Dr. Brannigan is working with a new therapy that's out, and we're going to have him talk about it a little bit tonight. Go ahead, Dr. Brannigan.
Well, thank you, John. I would actually first like to say thank you for having me, and thank you for all your listeners for tuning in. This is a real treat. I really appreciate the invitation.
Right, we have a few on.
Oh, great. So is there any questions that you have? Where you want me to start?
Well, we were going to, maybe you could just start out, the name of it and how long you've been doing it and kind of how it works.
Sure. So it's probably best for me to give you a little background about my history and where I come from. So I'm a licensed clinical chiropractor, and I've been a chiropractor for many years. And one of the things that I started to notice is that a lot of my patients weren't getting better as quickly as they should. And what happened was I started calling some seasoned chiropractors, people who have been in the business for 30, 40 years. I started asking these questions. I'm really, really good at this, and my patients aren't getting better. Why not? And he goes, oh, yeah, we're all seeing that. I said, really? Why? And he goes, the reason why is because people now are so toxic that the adjustments that we used to do are not working anymore. The impact to the nervous system is not as intense as it was 20, 30, 40 years ago. 50 years ago, you would do an adjustment and the patient's life would change. That's how much the nervous system was activated by an adjustment. Today, it's just not that way anymore. So with that, I started delving into doing some more intense chiropractic work. I got involved with functional neurology. And then through functional neurology, I got into functional medicine. And one of the things about functional medicine that I thought was very interesting is people got better, but they got better kind of. And the problem with functional medicine is they take a lot of extensive labs, and these labs are very expensive. But the lab doesn't tell you the whole story. And it's almost like if you open up a novel in the middle and try and figure out the story. That's kind of what a lot of these labs are occurring for us. And so to give you an example, if you did a hair sample or a hair test to see how much aluminum or how much mercury was coming through the hair, that lab isn't going to tell you where the aluminum is and where the mercury is. It's just in the system, but we don't know how deep it is or where it is. The other thing, if it comes back negative, whether it doesn't look like there's any mercury, we don't know that there really isn't any mercury, or we don't know that the body is actually holding onto it and not getting rid of it. So there's a lot of ambiguity with these tests. So through that, I met another doctor that was doing this technique called field control therapy. Field control therapy was designed by a doctor out of New York, and his name is a medical doctor, a medical cardiologist. His name is Savly Yarkovsky, and I believe the spelling of that name is Yurkofsky, and he's a medical doctor at upstate New York. And apparently what happened to him is he had a son that got very ill, and he knew that the conventional therapies, allopathic medicine was not going to help his son. So he had to get involved and figure out and basically get his son better on his own. He was originally from Russia, and he was involved with other scientists that were not just medical doctors, but actual scientists. And he was involved with William Tiller and Fritz Popp. And I also believe, although don't quote me on this, but I also believe he knew and was involved with Luc Montagnier out of France. And so they started doing this research and studying the frequency and how water can hold on to certain frequencies. And then they started to figure out that each organ in the system has its own signature frequency. So the design that was made was we utilized the autonomic nervous system to prioritize what organ in this person's body is in the most amount of stress. And then from there, we can figure out what's in that organ that's actually causing the distress. And we know through science that there's a lot of medical research out there that shows that a lot of destruction in human tissue is actually caused by infection. So if we can figure out where those infections are and then neutralize those infections, we can
and
heal
also heavy metals and inflation.
Exactly.
Inflammation.
Absolutely. And in fact, John, you're right about that. Heavy metals, in my research, from what I've seen so far, heavy metals are the predominant poison that is really creating havoc on the system.
Well, let me ask you, if someone had COPD, would they have a lot of heavy metals from cigarettes in their lung?
It's very common, yes. I have worked with COPD, and what I did find was cadmium. I've seen cadmium in the pulmonary system, and cadmium is interesting. It's a heavy metal, but a lot of people have cadmium because of cigarette smoke.
Right.
But also, cadmium is in the soil, so cadmium is also in rice.
Rice. Arsenic is in rice, too.
Exactly. 100% correct. Absolutely. So that's basically what we're doing. The uniqueness of this work that I'm doing is the prioritization. And that's really the key. And that's really what differentiates us from everybody else. So, this is it's kind of I wouldn't say a sad story, but it sort of illustrates the point I'm making here. Is I had a patient many years ago come into my office, and she said, I'd gone to this doctor. They looked into my eyes. They were an urologist, and they looked at my eyes. They said, I have a parasite infection. So they put me on this parasite cleanse, and I got really sick from that parasite cleanse, and I've never really gotten better. And they tried to help me after, but it never really worked out. I've never been the same since I did this parasite cleanse. And I looked at her and I said, I can tell you exactly why that happened. And this is the point about prioritizing, is the reason why this poor woman got so sick is because parasites feed on aluminum. And if she had a lot of aluminum in her system and they kill off the parasites, that aluminum is going to spread everywhere, which is what I think actually happened to her.
It's like cancer cells feed off of sugar.
Exactly. And the other great example is with candida. People have candida in their system, and candida holds on to mercury. And if you kill off the candida, mercury is almost contained in candida like water balloons. And it's like if you do a candida cleanse or you try to go through and kill off the candida, it's like popping these water balloons full of mercury, and the mercury just spreads all over the system, and people get really, really sick. So you've got to clean up the heavy metals first and foremost.
Heavy metals.
So especially with autism, which I do a lot of work with autism, to be honest, right out of the gate, most often than not, the first organ of stress is the brain. And the first thing that I find almost every time is aluminum.
Right.
Yeah.
What about like dementia and Parkinson's, Alzheimer's?
So I actually have a Parkinson's patient right now that's doing very well.
Wow.
With the Parkinson's, what I found was a lot of heavy metals in the brainstem and different recesses of the brainstem. So some of your listeners may know these areas, but most of us, if we don't have a background in anatomy and physiology, it would go over our head. But there are certain recesses of the brainstem called the substantia nigra, the right nucleus, mesencephalon, and these areas are really big on movement. So with tremors, they've got that pill rolling tremor that happens a lot of times with Parkinson's.
Yeah,
that's
the hands
a lot of
are
times
shaking.
that's coming. Yeah, that's
good
usually
for
the
Parkinson's
substantia nigra.
too. That's good.
Yeah, that's usually the substantia nigra that's being inhibited by or overexcited by heavy metals and toxins and infections.
So when their hands are shaking and stuff, that could be a sign of Parkinson's, I heard.
Yeah, you don't want to always jump to that conclusion because there are a variety of reasons why people have tremors. Like you can have something called an intention tremor. So, for example, if I was reaching for a water glass and I start to shake, that would be an intention tremor, which would not necessarily be Parkinson's. you can do an intention tremor where you don't see it until they get to full extension of the arm, and then the finger might wiggle a little bit. That might be related to the cerebellum, the hemisphericity of the cerebellum. So if one side of the cerebellum is weaker, they might get one of those little intention tremors. And a lot of times people just have idiopathic tremor, where they've had it since they were young, and it's not Parkinson's. It's just that they've got a slight little tremor, and sometimes there's a genetic component to that.
Well, if you had Parkinson's, what type of tremor or shaking might you have?
Usually, with Parkinson's, they usually call it a pill rolling tremor. So if you can imagine rolling a pill in your fingertips, something that looks similar like that, that would be indicative of a Parkinsonian type of tremor.
Wow.
And a lot of times it's in both hands. Sometimes it's just in one hand. When the disease progresses, sometimes you'll see the tremor of the tongue, and then sometimes you'll see the wrist involvement, and sometimes you'll see the feet.
Wow.
It just depends on how severe. They'll also have a stooped-like posture, and they tend to be hunched over a little bit, right? Okay.
Well, I had a guy who had Parkinson's I was working with, and he would get dizzy, and, I think he actually eventually fell down and hit his head, and he died.
Oh, sorry to hear that.
And, well, we covered this. We have some people on here tonight. They have different eye problems. Some of them have COPD. Some of them have macular degeneration. Optic nerve damage is a big one. Some glaucoma. Do you think this might help any neurological tissue to repair?
So it's a good question. So the goal for me is to basically remove the toxins and the infections that you find in the tissue.
Right.
So, for example, if you had Epstein-Barr in the optic nerve and the nerve tissue and the optic chiasm, those are fairly easy to neutralize and remove. When you have nerve damage, when the actual nerve has been damaged, that gets a little trickier. My contention is you have to clean up the system first before you start using other modalities there's a big modality out there that's becoming really popular, and a lot of people that have Parkinson's and MS and nerve damage are utilizing it with pretty good success from what I understand. That's called phospholipid therapy. But I know that you use a lot of different kind of machines and therapy. What I would do is clean up the system first, and then
that's one thing to try to detox people and get them cleaned up.
Yeah, utilize the therapy first. I have seen this a lot. I had a patient that had full-blown multiple sclerosis, and she had gone in for stem cell therapy, and the stem cell therapy didn't work. And so then she started to work with me, and I worked with her for about a year, and I got her where she was wheelchair-bound and on the verge of going into long-term care. And within about a month or two after working with me, she started to rethink the long-term care. And within a few months, actually, what ended up happening is that she was able to stand up on her own for 5 to 10 minutes, which prior to working with me was impossible.
How's she doing now?
She's doing much, much better. I haven't talked to her for a while, so what ended up happening is she worked with me for about almost a year, and then she went and did stem cell therapy. And the last time I talked to her, she was telling me that the stem cell therapy was actually working now. And I said, that makes more sense, because you got to clean up the system before these other therapies will actually start to work, because you're battling too much toxicity. It's kind of like
you got to clean it up.
Right. It's kind of like the example that I was using. How I started on this journey was the chiropractic therapy wasn't really working because the heavy metals and the toxins were overriding the nervous system. Right?
What about? I heard you had a lady that was had kidney failure and she was on dialysis, and she worked with you, and now she's not on dialysis anymore.
Correct. Yeah.
How'd that go?
Yeah, it went well. She was on dialysis, and we found, oddly enough, we found a lot of stuff in her brain, which was really interesting because I think because she was on dialysis, I just assumed that the kidneys were going to be the priority, and they weren't. It was actually the brain. And what's interesting about this story was that she was actually in a very severe car accident prior to having kidney failure. Now, the doctors never picked up on that. The doctors never picked up on that, and they didn't think that that would have anything to do with anything. But cleaning up the trauma from the accident and then cleaning up the toxins and the infections in the brain actually started to turn on the kidneys.
How long did it take for that to happen?
That one was tricky. That took a while because I was trying to. It was a little hard to figure out where the priority of her issue was because it jumped around a little bit. But that one took about a year. I think that one took about a year. Most of my patients, quite honestly, take about 6 to 9 months.
Wow, to get off dialysis, that's great.
Yeah, I have somebody that just recently. Oh, I have a thyroid patient that with just 3 to 4 months. Her TSA, which was the thyroid stimulating hormone lab test, which is sort of the gold standard test that most doctors use to see if you have a thyroid problem.
Right.
Her TSH was, I think, somewhere in the range between 10 and 20, which is really high. And,
was that Lisa?
What's that?
Was that Lisa, the girl with Hashimoto's that's working with you?
No, it was somebody else.
Does the pineal gland have any effect on the thyroid?
No, the pituitary does.
Pituitary gland.
The pituitary gland does. So you're asking a great question. So with this patient, the thyroid wasn't the priority. It was actually the hypothalamus. So the hypothalamus basically is the gland that creates the function for the pituitary, which is the gland that creates the function for the thyroid. So the thyroid stimulating hormone, the hormone is actually coming from the pituitary. So with her, it was the hypothalamus that was the problem. And then once I cleaned up the hypothalamus, the pituitary turned on, and then the thyroid turned on. So it was just literally just within a few months, she went from a TSH of 10 to 20 down to 4.
How many months?
3 or 4. Huh?
How many months did that take?
Oh, like 3 or 4.
Wow, it's amazing.
Yeah, just a couple of months.
Well, why don't you, also, you work with people like cataracts, glaucoma, macular degeneration?
I've had a few eye patients. It's not something that I specialize in, but I've had a few, and I have had some success. I have one patient, Lisa, that you mentioned.
Right.
I'm working with her eyes right now, and she is saying, and I've only seen her twice, but she's noticing that her eyes are actually working a little better.
Yeah, she's on tonight listening.
Oh, great. Hi, Lisa.
She's on there.
Hi, I'm on tonight. How are you doing?
I'm doing very well. It's good to hear you.
Awesome. Mm-hmm.
So it's not something that I specialize in, but I have had some success with that. And actually, I do have somebody that I'm working with right now. Her name is Amanda, and she's young. She's in her 30s. So she had a pretty severe accident where she lost control of a bicycle and hit a guardrail, and she had some detachment issues in her eye.
Retinal detachment?
What's that?
Retinal detachment?
Yeah, exactly. And so Could they
not reattach it with surgery?
They did reattach it.
Okay.
Yeah, they did reattach it. And this was, let me think about this. This happened probably around 2010, 2012.
Right.
And so now she's having some trouble and I'm working on her right now. In fact, she's just finishing up her first protocol within the next few days. So it'll be really interesting to see what she's noticed after this first protocol. That being said, I do also have a functional neurology protocol for the eyes that I actually utilized on her before I did the protocol. And she called me back several hours after I had worked on her and said, you know what, I'm actually seeing better. My night vision is actually physically better because I know at this time of the evening I really can't see, and I'm noticing that I can actually see.
After a few hours?
Just after a few hours, yeah.
What about macular degeneration? We have a lot of people with that.
So yeah, it's again, it just depends on what's going on with the macula.
A lot of people get that from too much light exposure from the sun. Working outside.
It can, ion radiation could certainly have a problem on the optic nerve.
Or blood flow to the cells.
Right. There is a lot of that. That's very possible. You have to remember that, so here's an interesting factoid. They were doing some research papers recently where they were doing umbilical cord studies of children being born today and testing these umbilical cord studies as well as doing some biopsies of the tissue of the newborn. They're finding over 287 different toxins in the umbilical cord and the tissue of newborns right now. This is before any toxic exposure. This is before any vaccinations. It's before anything. And this is what they're finding in kids being born today. So that's kind of toxic.
They have all these toxins in their body because their parents were probably toxic.
Exactly right. And we're noticing now that it's becoming generational.
Would that affect umbilical cord stem cells?
It's a good question. I have no idea. I would think that it probably would. I don't see how it couldn't. But that's a good question. That's a really good question.
Well, we have a guy listening tonight, Dr. James. He's on dialysis, but he also had pneumonia, and he went in the hospital. And when he woke up, they put him in a coma. And when he woke up, he was blind in both eyes. He had a detached retina in both eyes, and they couldn't get him reattached. So I was wondering if there's any help for that.
Yeah, I don't know. I mean, if the retina is not attached,
it's hard.
It's a good question. I don't know.
But he did.
Let me. Can I ask you
a few
questions?
Go ahead.
How you doing, sir?
Sure, I'm doing well. Thank you.
Dr. Brannigan, how you doing?
Yes.
Dr. James is a podiatrist.
Oh, hi,
Doctor. I was listening. I have a couple questions for you.
Sure.
First one is that you said that the woman with the dialysis, she was in a car accident, and then she developed kidney failure or kidney problems.
Yeah.
Now, I was thinking that, because this is my theory with that, is that car accident stimulated her sympathetic nervous system, the fight and flight reaction. And automatically, when you get a sympathetic nervous system stimulation, that's going to stop your urination. Because
it can do that, yeah.
Fight and flight reaction, and the blood flows from your internal organs to your skeletal muscles to give you energy to fight or flight, to run or fight.
Yeah.
So this is the reason that that might have shut off her kidneys, because when you have a traumatic injury such as that can cause you to have a chronic sympathetic response. Or this is my theory. Now,
Dr. James, you also wanted to know, are these
I'm going to the next one.
The frequencies radioactive? Or?
Yeah, I got about 3 questions for
All
him.
Right, go ahead.
That's one of them. So that might be the case. So when you stimulate it, use that frequency, then that could have like you said, it affects her brain, and it stopped that chronic sympathetic response, then that might have relaxed her kidneys and allowed her to urinate.
And Dr. James is diabetic.
Yeah, and that's one thing. I'm diabetic, and I got a lot of problems. I don't like to tell all my problems, but
all right.
That's the one thing. Now, the other thing is with the eyes. You said you haven't done too much work with the eyes, right?
Yeah, not a lot. I've had a handful, but not a ton.
You'll get a lot of them from me.
Okay, so mainly your conditions are what, nervous, neurological conditions? You work with
well,
a lot.
I've had some neurological conditions, but most of them have been autoimmune.
Autoimmune?
Yeah, a lot of autoimmune.
There was one more question I asked.
Hashimoto's, lupus, rheumatoid arthritis, diabetes.
I got diabetes, but other than that, I don't have any of the others. But the other question I had is, you said you work with oxygen. Do you work with a hyperbaric oxygen chamber?
No, I'm sorry, doctor. I said I work with autism, not oxygen.
Oh, I thought you said oxygen. Are you familiar with hyperbaric oxygen?
Yes, I am.
There was a doctor, ophthalmologist in Long Island, New York, who was saying that he can use hyperbaric oxygen to stimulate the optic nerve to work. You're familiar with anything like that?
Yeah, I don't use hyperbaric oxygen chambers, and the only reason why I don't is because they're so expensive. But I do like the science behind it. I don't know a lot of it, but it regenerate nerve. I do know that in a lot of issues, especially cerebellum issues, in certain conditions, that's a highly oxygen-deprived organ. So I know that the hyperbaric has done some pretty interesting things with that. But I don't know in terms of the hyperbaric, whether that would stimulate nerve tissue. I honestly have no idea. And
the last question I got, because this is what John just said about the frequency. What frequency do you use, or do they use?
So that question makes me think that you think that I'm using some kind of machinery when I do this therapy or when I test this therapy, and I don't. So each organ has its own signature frequency. Like the heart resonates.
Yeah, I understand what you're saying. Yeah.
Okay. So what I do is I have how do I explain this? I have a very large series of vials that are holding the frequency of certain organs and tissues, and then I have vials. Yeah, and then I have vials that have the different frequencies of bacteria and viruses and molds and heavy metals and different toxins. So what I do is I use the autonomic nervous system to create a match. So, for example, if you had diabetes, I'm going to keep that in the back of my mind. So the things that I would want to test for you would be, I want to look at the pituitary, I want to look at the hypothalamus, I want to look at the inlets of Langer, which are the cells that make up the pancreas. I want to look at the pancreas itself. I want to look at the nerve tissue. Those would be my first orders of business. But, again, it's your nervous system that's actually sort of directing me where I need to go and what's the highest priority. So I kind of go off of what I'm finding with the swab test and how the frequencies of your organs are directing me. Then once I get that done, I create a picture, a blueprint of what's going on in your system, and then from there I make frequency remedies based in water to provide you to take. So you might get a series of maybe 11 vials, and you're going to take one drop of each vial one time, and they'll go 1 through 11, and it'll take 5 or 6 days to complete that, and then you're done. And that's the protocol for that sitting. And then about 3 or 4 days after you finish, I want to kind of go back and talk to you about how are you feeling, what are you noticing, what's changed, how's your energy, how's your sleep, how's your digestion, How's your intake for this and this? What do you notice? And then from there, we wait another 2 weeks or so, and we basically do another test. So I test people on the average every 3 to 4 weeks. If you've got
but I live in New Jersey, so you
okay.
do this in your office, right?
No.
Yes.
Tell them how you work with people at a distance. You send them the
Yeah,
forms
so what I do,
and
that's
the
what the swab. Yeah, so what I do, that's what the swab is for. So what I do is I take the swab and you put it between your cheek and your gum, and you put the cap on. And then what I do is I take that swab, and I can use that swab as a testing mechanism. And that's how I do things from a distance. So I just use the swab. If you're in my office, then I just test your body directly. And I know that seems like difficult to do, but it's actually not. And I see,
that's a muscle test.
To be perfectly honest, the bulk of my patients are actually from out of state.
Right. What about these frequencies? Are they radioactive or any?
No
radioactivity or anything? Yeah, I didn't think so.
Absolutely not.
Yeah, that's what I was going to ask you also.
Yeah, no, they're not radioactive at all. Actually, it's the remedies that you'll be taking are water-based. And the water is literally holding the signature frequency that I implemented into it. So I have a machine called a potentizer that I utilize, which transports the frequency from the testing vial into the frequency of water vial that I actually give to you. So the beauty of this is it's a frequency system. And so therefore, it's not based in chemistry. So any medications that you're on, it doesn't really interfere. So you can take all your medications just as directed. There's no problem. I occasionally have some issues with certain supplements if they're herbal-based or if they're frequency-based like box remedies or essential oils. I usually have people sustain from taking those during the time that they're on the protocol. Once you're done with the protocol, you can go back to your box remedies or essential oils. One of the things that I will say about medications is, and I've seen this quite often with diabetics, and I've seen it a few times with people that are on thyroid medication, is I have to let them know, as you take these remedies, and it usually doesn't happen after the first protocol, but after the second protocol, third protocol, take notice because the medications that you're taking might be too much. And I've seen this a variety of times with diabetics where the amount of insulin that they're taking has to be reduced because their body's getting cleaned up and they don't need the dose that they originally were taking. So I just let them know, just be mindful that you might have to talk to your doctor. You might have to slowly decrease this because you're not going to need as much.
Dr. James, do you take insulin?
So I need to get your information from John, I guess.
Do you take insulin, Dr. James?
Oh, yeah, you gave it to me, John. You left it on my phone. Okay.
Do you take insulin, Dr. James?
No.
Also, Dr. Brannigan, the people you worked with, the COPD, how did they do?
Oh, they did very well.
All right.
Yeah.
I got a few people that have COPD and bronchitis and just all kind of strange stuff.
My success rate is really pretty high. I can only count on maybe one hand of people that I really struggled with. And more often than not, what I've noticed is one of two things. People that don't do well with this protocol, it's one of two reasons. One, they're not taking the remedies as prescribed and they're taking it their own way and they're not following the directions. Or there's an emotional component that's actually the primary cause of their problem, which is
or
common.
They keep smoking cigarettes, or they keep drinking.
Right. Well, that would be smoking cigarettes would be more of an environmental toxin, and that is a problem because they're reinfecting their system. But what I mean is, like, if you have an individual whose spouse has left them, and they're in an emotional chronic state, it's going to be and that's the reason why the physiology is breaking down or being interfered with. Sometimes I can't necessarily override that because the primary is really an emotional issue.
To work on that emotional stress.
Yeah, that's only come up a few times. most of the time, it's not an issue. Now, I will say this. This is also very interesting. I had a patient that I had worked on before, and she had a psychiatrist. And the psychiatrist wanted to put her on medication for her chronic anxiety. And she had been suffering with chronic anxiety for many, many years. I'm going to say probably around 15 to 20. And the psychiatrist told her, look, I want to put you on this medication. She said, absolutely not. I don't want to go on any more medication. I'm done with that. I don't want any more. He goes, well, then I can't really help you. And the psychiatrist was actually somebody that I used to work with when I worked for another medical clinic. And he said, well, if you don't want to go on medication, the only thing that I can offer you is go see Dr. Brannigan. And she said, oh, I know Dr. Brannigan. Well, his field-controlled therapy is very interesting, and it might have something, it might help you with your anxiety. I think I saw her 3 times. And after the 3rd visit, she came back in and she goes, I don't believe it. I don't believe it. But my anxiety is gone. And I've had this happen several times.
What about rheumatoid arthritis?
I've had a patient with that. I saw her twice, and the labs came back saying that she no longer was testing positive for rheumatoid arthritis. Her Rh factor was negative.
We have a few people on here. We have about 15 minutes left. I
Okay.
wanted to see if anybody out there might have a question for you.
Sure.
So if anybody has a question, go ahead.
Hi, it's Ivadane. I am grateful. Hi, I am grateful for your visit here on John's show. Thank you, John, for bringing him, because this sounds like this can help a lot of people with a lot of different ailments and, a lot of disorders going on in their bodies. I'm changing my language. And it's great. It's great. I will share. I will be in touch. And thank you both.
No, well, thank you.
Anybody else have a question?
Yes, John, can you hear me?
Yeah, this is Adrian, isn't it?
Yes.
Hi, Adrian.
Hi.
She has a uveitis and her pupils are shut.
Yes.
Wow.
And that's what I was going to ask about. You are the first person. I've been to several doctors, and they sent me to several specialists. They sent my records to Paris, Japan, everywhere. And it took them 9 months to come up with a diagnosis of uveitis. And then it took them another 3 months to figure out what to do about it. And I wanted to ask you, since you mentioned it, I've been in and out the room, how is the lady that you said you're working on it, how is she doing it? Is there any improvement in her sight? Did she lose her sight totally?
No, she hasn't lost her sight totally, but she's noticing that her vision is becoming more impaired. And I don't know how well she's doing just yet, because she's right in the middle of her protocol. She did tell me when I spoke to her yesterday, well, she texted me yesterday, she did say that she did notice that her eyesight got worse after, I think she said it was like the 3rd or 4th or 5th vial. She was noticing that her eyesight was actually physically worse. And I said, well, that's actually might be a good sign, because when you're leaching out these toxins and infections from the organ, a lot of times the organ gets a little bit worse before it gets better. So she's at the tail end of her protocol, and I would expect, or I'm hoping, fingers crossed, hoping that she's going to call me back in another 4 to 5 days to go, okay, I finished the protocol. It's been about 4 or 5 days after I finished it. Here's what I'm experiencing. This is what I'm noticing, and it's all very positive. So that's what I'm hoping.
Her pupils are closed, and she can't see much at all. So.
Wow.
I can't see anything. I see nothing. I see white light.
Yeah.
Wow. And now, how did this start?
I just literally woke up one morning. Well, no, I was in night school, and I left school one night, and everything was blurry, and I couldn't see anything. because I couldn't drive home, and even though street lights was on, I couldn't see anything. And the next morning, I saw nothing.
I thought it was from the radiation from the fluorescent light bulbs that she'd been sitting under all this time in school. And
yeah,
that's not a bad guess. Fluorescent lights do emanate a lot of mercury
and radiation.
So that's very possible. Yeah, that's a very interesting case. I would be interested to see what I could tell you about that from my perspective.
All right, somebody else has a question. Who's
Somebody is. This is a doctor. He's I'm behaving myself very well.
Who's that?
Hello?
All right, anybody else have a question? We got a few minutes left.
Thank you.
We didn't get nothing.
Hello?
All right. Well, that's a lot of great information in just the short period of time we've been on here. So I want to do like a last call if anybody has any questions.
Yeah. How can we reach Dr. Brannigan?
Well, he's going to give out his phone number and website, and I have his phone number here. My website is drbanker.com, and my office number is right there on the home page. And Dr. Brannigan, why don't you give out your phone number and website?
Yeah, the best way, honestly, to reach me is the number is 916-545-0029. And my website is BranniganHealth.com. And I'll spell that for you. It's BRANNIGAN Health, HEALTH.com. Now, just so you know, those that are still listening, my website is down at the moment. It's being updated. So if you go looking for me right now, you're not going to find me. But I am hoping within the next week, in the next 2 weeks at the latest, it will be back up and ready to go. I do have a few video testimonials on there. We're in the process of getting some more. We've got a waiting list of people that want to give a video testimonial, but it's taking time to get my video guy booked because he's very busy. If anybody else has any other questions, let me know.
Yeah, they'll be able to check out. Oh,
go ahead.
Go ahead.
Yeah, this is Lisa. Yeah, once Dr. Brannigan gets his once he gets his website up, people will be able to see my video on the improvement I've had from the Hashimoto thyroid.
Yeah, she did.
That's right. Thank you, Lisa, for doing that.
Yeah. And I just wanted people to be aware that they'll be able to see, hear our interview and the progress that I've made just within 2 protocols.
Yeah.
Thank you. My question was the cost. I don't know if you mentioned it already, but what is the initial cost? And then
okay. So because John is doing this website, John is doing this podcast, my cost for right now is going to be $200 per visit. So a lot of doctors that do field control therapy, they're very, very expensive.
Yeah.
And a lot of them charge an app cost of several $1,000s, and then their follow-up visits are somewhere between $500 and $600. I'm not doing that just yet, so right now I'm charging $200 per visit, and that's going to be only for a short amount of time, because probably come towards the beginning of next year, it's not going to be the same. It'll be a little bit different.
But we'll be grandfathered in, correct?
You will 100% be grandfathered in, yes. Yeah, those who are with me now, you're going to stay the same.
We got about 5 more minutes here.
Yeah, that would include me too, right, Dr. Brannigan?
Yeah, no, don't worry. Don't worry. You're safe.
Elizabeth, you still listening? Elizabeth, I guess she hung up.
Oh, yes, I'm here.
All right. Did you have any questions? You're sending back his. You were having some trouble filling out.
I did today. I did.
So you got the form filled out?
No, I'm going to take care of that for her.
All right.
Yeah, we're not going to worry about that for her right now.
Some of these people can't see good, and they can't fill that form out too good. I guess they could get someone to help them if they can, or you could help them.
Yeah, we'll work something out.
All right. So
I hate to have somebody not have treatment because they can't fill out the form. So
when you worked
figure out a way to help them out.
When you worked with people with COPD, how long did that take to get them breathing?
That is the one that I had. Took a little while. I think it was around 6 to 9 months, if I remember correctly. It was a while ago. But they did do better. And here's the other thing, John, that people should know. One of the things about this system is I can pretty much figure out early on whether I can help them or not.
Right.
So usually what I want to manage people's expectations about what I'm doing. So usually what I do is I say, give me 3 visits, and then let's evaluate. I'll be honest, most people usually feel something, a change, a shift after the first visit, but sometimes they don't. Sometimes it takes 2 or 3. If you are not having any progress or changes after the 3rd visit, then usually there's something that I'm missing, or it's something that I can't really help.
All right, we got a couple more minutes. Why don't you give your phone number out again? And your
website, my number is area code 916-545-0029.
Permission to speak?
Go ahead.
Yep.
I've been listening. I've been off and on multitasking. But I'm going to take what you just said, and I'll take my question from there. When you said that you help somebody with the breathing condition, now you said that it takes 6 to 9 months. My question is about everything that you said, but I want to ask this question about that right there. Is that, did you cure that person, or did you just help that person breathe a little better?
I don't remember. I think what happened with that patient is I saw them for about 6 months, and I think they felt like they were good enough so they didn't need to continue.
Were they on oxygen when they started?
No. They were breathing on their own, and they were good.
But I mean, when they started with you, were they on oxygen?
Oh yes. They were on oxygen. Yeah.
Every day. Well, some of the people I'm working with, they're not on oxygen that much, so that's good. Go ahead.
OCPD comes with emphysema. It comes with a couple different breathing.
Bronchitis.
Yes, it comes with all that. Asthma, it comes with all that, right?
But it's usually a problem with the alveoli and the lungs being damaged.
Yeah, a lot of times it's the alveoli, but I have seen issues with the vagus nerve.
All right.
Thank you, sir. I appreciate your time.
Sure.
All right, so we got about 1 minute left, so I'm going to have to stop the show here now.
Okay.
And thanks for calling in, Dr. Brannigan. And
thank you guys for having me, and I thank your listeners for chiming in, asking questions, and listening. Thank you.
Yeah, thank you.
All right, and we'll be on next week, 8 p.m. Eastern on the Vision Care Show, and I will talk to you guys next week.
Thanks, John. That was a great show.